Hello, my name is Lindsay Phillips, and today I'm going to be discussing the issue of breast cancer in three different countries. And the countries we'll be talking about today are the United States, Germany, and Costa Rica. For those of you who don't know, breast cancer is a disease in which abnormal cells grow out of control in the breast, forming tumors. And these tumors can create lumps in the breast and spread to other distant sites of the body, becoming fatal. And I'm sure a large majority of you could name someone you know who's been affected by breast cancer. But this is not just a problem here, it's a problem no matter where you're located in the world, whether it's a developed nation such as the US or if it's a developing country like Costa Rica. And what I found when diving deeper into this issue in these countries is that there's more similarities than there are differences when it comes to breast cancer. And what I mean by that is cancer's cancer, treatment's treatment, and unfortunately, there is no cure. So it's pretty similar across the board. One of these ways that these two countries are similar in who it affects. The highest affected group in all three countries are women ages 55 and up. And although they're the majority, men can also be affected, as well as people as young as 20 years old. Some societal risk factors for Germany and the US are those who live in rural areas are typically diagnosed later and can have a worse prognosis. And this is actually opposite for Costa Rica. And some other risk factors for all three countries are family history, alcohol use, smoking, and obesity. In Germany, some other risk factors that have been proven are education level and relationship status, meaning that women who lack higher education or those who aren't married have been proven to be diagnosed later. Breast cancer is the most common cancer for women, accounting for 1 out of 4 cases, and this map depicts the most frequently diagnosed cancers in women around the world, breast cancer being represented by pink, and as you can see, this is a problem everywhere. The incidence rate of breast cancer is high. In the US, it is predicted that by the end of 2024, over 300,000 new cases of invasive breast cancer will be diagnosed, and 1 out of 8 women will develop it at some point in their life. Not only do a lot of women experience breast cancer, but unfortunately, many are dying from it. 1 out of 6 cancer deaths in women are from breast cancer. As grim as this seems, it is improving. In all three of these countries, the mortality rates are decreasing. Most diagnoses come from routine mammogram screenings. Germany has actually attributed their decline in incident and mortality rates to increased screenings for women ages 50 to 70, which allows tumors to be caught before they can progress to higher stages. The three main treatment methods for breast cancer in all three countries are surgery, chemotherapy, and radiation therapy. In just 3 years, Costa Rica increased their spending for cancer treatment by $16.6 million. Overall, I would say healthcare systems in all these countries are helping patients with breast cancer because this is where they're being diagnosed and treated. Of course, they could improve. Costa Rica could keep up to date with the latest technologies. The US could focus more on prevention. There is always room to grow. The government in the US helps fight against breast cancer by passing laws that affect both research and care of breast cancer. Costa Rica's government gives access to screenings through the CCSS, which is their public insurance, largely financed by their government. Germany's government does a lot for its citizens who face health issues. They allow anyone to be seen at any facility regardless of their insurance status, and their public insurance also pays for all interventions medically necessary, including all breast cancer treatments. Germany and Costa Rica both have near universal health coverage, while the US does not. In Costa Rica, if a citizen isn't able to contribute to their insurance, they are still covered and financed by the state, and 88% of Germany's population has public health insurance. Germany's government also provides an impressive amount of sickness benefits, including 3 years of time off if you're unable to work due to illness. So while these people are fighting for their life, they don't have to worry about also losing their job, which is incredible. And as we've learned, access to healthcare is key to success when tackling a problem such as breast cancer. If an individual doesn't have access to care, whether it's from a financial standpoint or even for a geographical reason, they have less of a chance at healing. In the US, we have the newest technologies, medications, and facilities, but if people can't afford them, even with their insurance, then what's the point? Having universal health insurance could change the outlook for many Americans. So, in conclusion, breast cancer is a serious problem that affects millions of people around the world every year. These countries we've discussed today are continuously improving their outcomes for women affected by this disease, but until no lives are lost to breast cancer, there is still a lot of work to be done. Thank you for listening.